Okay, I've been waiting to make this video for weeks. My 13-week lab results are back, and every single marker moved in the right direction. Mind-blowing. I'm sitting here looking at these labs, going through it, and genuinely want to cry a little bit. That's how improved they are in 90 days. And it's not because I'm surprised that Mounjaro works or the GLP-1 works. I'm a nurse practitioner. I've prescribed these medications before. I know what they're designed to do. But there is a profound difference between prescribing something and living it. Between knowing the clinical outcomes and seeing your own numbers shift after 13 weeks of doing the work. And today I get to share that with you. So here's what we're doing in this video. I'm going to walk you through each of the 5 lab markers that I have been tracking in my own personal journey. I'll explain what each of these measures, what the ranges mean for women in midlife specifically, how Mounjaro transforms it, and then the part I've been most excited about is sharing my actual numbers with you, before and after, from week 0 to week 13. On this channel, I've been talking about labs theoretically for weeks, but it's time to show you what it looks like in practice. A real body, my body. Let's get into it. Welcome to my channel, Fallon G, the Midlife MP. If you're new here, welcome. If you're not new, welcome back. I'm Fallon. I'm a dual board certified nurse practitioner in both primary care and mental health. I am journaling my own journey with perimenopause, post-VSG weight gain, and a new GLP journey on Mounjaro. Everything I share today is my own personal health journey and clinical perspective as a nurse practitioner. My results are not a benchmark. Your body is different. Always review your labs with your own healthcare provider. Before we get into the results, I want to say one thing clearly. My numbers that I share today are just my data. They are not a benchmark for you. I'm only sharing a data point, okay? One midlife woman's body, 13 weeks on tirzepatide, with all the specific variables that make my body mine and not yours. What I hope you take from this isn't comparison. I hope you take it as a framework. What the labs mean, what direction they should move, and what questions you need to bring to your own provider. That is the whole point of this channel. You deserve to walk into that appointment understanding your own data. All right, 5 labs. Let's start with the one that has the most immediate cardiovascular impact. Your cholesterol panel gives you 3 numbers that together paint a picture of cardiovascular risk. The LDL, or low density lipoprotein, is the one that accumulates in the arterial walls. So lower LDL is better. Your HDL, or high density lipoprotein, clears cholesterol away from the arteries. The higher is better for women. We want to see this number above 50. And triglycerides reflect how well your body is managing unused calories and sugar. And this is the one that's mostly directly tied to insulin resistance. Triglycerides are also the number that tends to move the fastest on the GLP-1. And I've been watching mine since week 1. Now let's take a quick look at what these labs look like. I'm going to tell you what the normal is, but also what the optimal levels are. Now your LDL, remember that's what we consider kind of the bad cholesterol, because that is what builds plaque in your arteries, okay? You want that to be less than 100 is optimal. Between 100 and 129 is kind of normal. And then anything over 130 is cause for concern. Your HDL, we want to be optimally above 60. And the borderline is about, or normal, is about 50 to 59. And then if it's less than 50, that is a concern. Your triglycerides need to be less than 100. That is optimal. And the norm is between 100 and 149. And anything above 150 is an area of concern. Now, let's go over what my labs did when it came to my cholesterol panel. When I started the medication, my cholesterol level, the total cholesterol level was 261, okay, which is very high. Very high. That is an area of concern because that's in the above range, okay? It went down, my total cholesterol went down to 142, which is normal. Less than 200 is what you want that number to be. And so I'm in the optimal range of 142. Now, let's be specific. What happened with my triglycerides? My triglycerides went from 195. Now, I told you we wanted to be less than 100, and greater than 150 is an area of concern for cardiovascular risk. Mine was 195, and it is now 98, which is in the optimal range. My LDL went from 163, which is very, very high. Okay? 163, which is very, very high, to 74, which is in the range of optimal. So it didn't just go back to normal, it went to an optimal range. And my HDL is still hanging out around 50. It was 50 before, it's about 50 now, and it's just hanging out there. And my goal is to get that above 60. Look at those triglycerides. From 195 down to 98 in 13 weeks. That is a 97-point drop. Now, I knew this would move because triglycerides most always respond first on a GLP-1, especially when you're eating less processed food and more protein. But seeing it on my panel is a completely different experience. That number tells me my insulin resistance is improving. My body is processing fuel more efficiently. This is not just a number going down. This is my metabolic health measurably changing. Triglycerides are my favorite early win marker for GLP-1 patients because they respond within weeks, not months. And they give you something to celebrate early in the journey when the scale may be doing unpredictable things. A drop from the borderline or high range into normal range is clinically meaningful. It reflects improved insulin sensitivity, reduced liver fat production, and better overall metabolic function. This is not cosmetic, but this is cardiovascular protection. For women in perimenopause, estrogen decline raises the LDL and lowers the HDL. So raises the bad cholesterol and lowers the good cholesterol. The fact that my LDL dropped and my HDL stayed stable in 13 weeks in a perimenopausal body without any hormone replacement therapy is a result I am genuinely proud of. Diet quality and Mounjaro working together. Now, completely transparent here, I am on a cholesterol medication as well, a low-dose rosuvastatin medication to help decrease the cholesterol because it was so elevated. My provider wanted to decrease my cardiovascular risk with medication as well because it was so dangerously high. I project that I will probably be going off of that low-dose medication or decreasing it at my next visit because those were the goals. And the medication is doing exactly what it should be doing, along with working with the liver. Hemoglobin A1C measures what percentage of your hemoglobin has been coated with glucose over the past 3 months. So basically, how sugar-coated are your red blood cells? It is a 3-month blood sugar average. Honestly, a slow-moving and very hard to manipulate level. Below 5.7% is normal. Between 5.7 and 6.4% is what we consider pre-diabetic. And 6.5% and above is where you hit the type 2 diabetes threshold. Now, I need to tell you something before sharing this number. When I started Mounjaro 13 weeks ago, my hemoglobin A1C had went over into the diabetic range. I technically, clinically, was diagnosed with type 2 diabetes. As a nurse practitioner, as someone who knows exactly what this number means, as someone who's had this conversation with hundreds of patients in my career, it was sobering. And it's a part of why I started the medication. My levels went from 7.2, which is clinical type 2 diabetes, down to 6.0 in 13 weeks. That is amazing. Usually when I'm treating patients in practice, if we're trying to get the A1C down, it can take 6 months. If we can move it a few points 6 months, that is excellent. Okay? The fact that it moved in 90 days, 13 weeks, is insane. I am now into the pre-diabetic range, the lower end of the pre-diabetic range, which means that I am about 5 points away from being normal, which I absolutely believe is going to happen within the next few months. I have sat across from patients in my practice and told them their A1C had to come down. I've watched their faces. I've understood what it means for them clinically and the work that they would have to put into it. But I'm telling you right now, sitting here looking at my own number, this hits completely different when it's your body. This is not just a number. This is my future. This is my risk profile completely changing. This is Mounjaro doing exactly what it was designed to do, improving insulin sensitivity at a cellular level, bringing a diabetic woman back into almost a normal metabolic range in 13 weeks. And I am so utterly grateful. A 1.4% reduction in a hemoglobin A1C in 13 weeks is clinically very significant. Research consistently shows that by each 0.1% reduction in hemoglobin A1C is associated with measurable reductions in long-term cardiovascular and microvascular risk, meaning your small vessels. Moving from a diabetic range to a pre-diabetic range and almost normal is not just a number improving, it is trajectory actually changing. For women watching this who are in the pre-diabetic range from 5.7 to 6.4, I want to say this directly. That is an action zone, not a waiting zone. Mounjaro's dual GIP and GLP-1 mechanism directly addresses insulin resistance that drives prediabetes. This result in my own body is a clinical demonstration for you of what the medication is designed to do. If your hemoglobin A1C hasn't been checked recently, this is your time to ask for it. One important clinical note here. The A1C can be falsely low in women with iron deficiency anemia, which is very common in perimenopausal women who have heavy periods. If you are bleeding significantly and have a history of heavy periods, please mention this to your provider when reviewing your results. We want to make sure it's not falsely low and you may be in the pre-diabetic or even diabetic range and not know it because of the anemia. So please talk with your provider about this. Your thyroid is your metabolic thermostat. Your TSH, or thyroid stimulating hormone, tells your thyroid how hard to work. Your free T4 is what the thyroid produces. Your free T3 is the active form your cells can actually use. And getting all three, not just your TSH level, is how you see the full picture. I specifically always ask for a complete panel, and I want to show you why. Let's talk about some reference ranges here. Your TSH level, the normal range, or the standard range, is 0.5 to 4.5. For you to know that you're functioning optimally with your thyroid, it should be between 1.0 and 2.5. Your free T4 level should be 0.8 to 1.8. And to be optimal, you should be in that upper range, the 1.2, 1.8 level, okay? For your free T3, the levels should be 2.3 to 4.2. And to be optimal, you need to be in the upper half of that range. Now, starting with my labs, I was hypothyroid. I was diagnosed with hypothyroidism when I did my labs initially. My baseline thyroid stimulating hormone, or TSH level, was 5.9, very elevated. 13 weeks later, it is 1.9. My free T3 level was 2.6 and is now sitting at 3.1. This is why I asked for the full panel. I was in hypothyroidism, and I needed to also see what was going on with the hormones that my thyroid was producing and how was my body actually using it. I have also been transparently on a thyroid medication. I take levothyroxine, a low-dose levothyroxine. I presume that when I see my endocrinologist again, we will also go down on that dose because it is now 1.9, and we want to stay within that 2.5 range. I would like to see it sit at about 2.1 and be there at an optimal range. And so going down on the medication a little bit will help me get there and make sure I don't keep going too low on the TSH level. TSH alone is not the full thyroid story. And I've seen patients with a TSH of 2.8, which is technically in the normal range, but their free T3 sat in the lower range. And they had every symptom of having suboptimal thyroid function. They were fatigued, they had slow weight loss, brain fog, they felt cold all the time. All of these things are signs of your thyroid not functioning well. Now, without T3 on the panel, the picture is invisible. This is why I ordered the complete panel for myself and why I recommend it for every GLP-1 patient, especially with persistent fatigue or weight loss resistance where you feel like the scale isn't moving. This is the first thing you really need to check if the scale is not moving and you're doing everything you're supposed to do. You're hitting your protein goals. You're hitting your fiber goals. You are eating meals and managing your appetite. If all of those things are pretty much in check, and you're still feeling fatigued and you're still plateaued after weeks and weeks, please check your thyroid function because that could be the key to unlocking the weight loss. If your provider has only ever run a TSH and you resonate with any of the symptoms I talked about, ask specifically for your free T3 level and your free T4 level to be added. It is completely reasonable to ask for this and is a completely reasonable clinical request. ALT and AST are enzymes that live inside your liver cells. When the liver is stressed, usually from fat accumulation, inflammation, or it can be from medication, they leak into the bloodstream. So elevated levels are your liver asking you to pay attention. A mildly elevated ALT is extremely common in midlife women, especially with insulin resistance. So this is often linked to metabolic fatty liver disease, or what we call MASLD, that nobody told them they had. Now, the levels that you want your ALT are less than 35, and the AST you also want to be less than 35. If they're between 35 and 70, you're mildly elevated, and if it's greater than 70, you really need to follow up with a liver specialist to see what's going on with your liver and have more testing done. Now, at baseline, both of my levels, the ALT and AST, were both 21. They're now sitting around about 20, 21 as well. So there was no real change there. Now, I did have some evidence of some fatty liver in ultrasound, but my levels weren't elevated in my blood yet. Now they're still in that kind of normal range, but remember, this is a result you cannot see in photos. You cannot see it on the scale. But if they're elevated or even mildly elevated, your liver cells are being stressed. And the visceral fat that presses on your liver can cause problems. When this level starts to go down, that visceral fat that was pressing is now starting to reduce. Mounjaro does its job decreasing the levels of liver fat and accumulation of visceral fat, and data proves it. Mildly elevated liver enzymes normalizing on a GLP-1 is consistent with what we have seen in clinical trials. Visceral fat, which is the primary driver of MASLD, or metabolic fatty liver disease, and it's elevated ALT. This responds early to GLP-1 medication. This is one of the most exciting new developments in the GLP-1 research right now. Eli Lilly is specifically studying Retatrutide and tirzepatide for metabolic fatty liver disease. The liver improvement many GLP-1 patients experience is not incidental. It is the medication addressing a metabolic disease at its root cause. Vitamin D is a nutrient that almost all of us are low on, and the one that becomes even more critical on a GLP-1 because appetite suppression reduces dietary fat intake, which means fat-soluble vitamins like vitamin D absorb less efficiently unless you're intentional about it. Now, I've been taking my D3 supplement with my largest meal every day, and let me show you what that did. First, let's talk about some reference ranges. Anything below 20 is considered a clinical deficiency in vitamin D. Between 20 and 30 is an insufficiency. 30 to 50 is sufficient by standard lab standards, but 50 to 80 is optimal function, especially for women in midlife. Now, my vitamin D levels went from 13.5, which is severely deficient, up to 54, which is optimal. I went from sufficient to optimal in 13 weeks. This is the power of being intentional. Again, I was at 13.5, which is technically severely clinically deficient, and I supplemented consistently. I took my D3 supplement with my biggest meal of the day, and now I'm sitting at 54. This is solidly in the functional optimal range for a midlife woman. My bones are getting the support they need, my immune function, my mood, my muscle recovery, all benefits from this number being where it is now. Moving from 13.5 to 54 in 13 weeks with consistent supplementation is a great result and is completely achievable for most women with the right dose and absorption strategy. The fact with meal timing is optimal on a GLP-1. It is how you ensure the supplement actually works. For women not on hormone replacement therapy, achieving and maintaining vitamin D in the 50 to 80 range is one of the most important bone protection strategies available. Another tip, pair it with vitamin K2 to ensure calcium is directed to the bones rather than to your arterial walls. If your vitamin D hasn't moved despite supplementation, check the form you are taking. D3 is more bioavailable than D2. Check the timing. Also take it with a fat-containing meal. And then check the dose. Most midlife women need about 2,000 to 4,000 IUs daily. I take 5,000 IUs daily. This helps reach and maintain optimal levels. Some need more. Some need a little bit less. This is worth discussing with your provider. I'm going to look at these results one more time before I close this video. Triglycerides down 97 points. LDL moving in the right direction. HDL stable. Hemoglobin A1C out of the diabetic range. Thyroid full panel improving. Liver enzymes normal. Vitamin D optimal for the first time, probably in my life. 13 weeks. This is what 13 weeks of Mounjaro, intentional protein, consistent hydration, a morning tracking habit, taking my supplements, resistance training looks like in a midlife body. Not a clinical trial, not a carefully controlled research environment. My actual life with all of its imperfections, busy days, hard weeks, stress. I share this not to celebrate myself. I share it because I know there are women watching this video who are at week 2 or week 5 or week 9 for that matter. And you're wondering, is this actually working? Who are looking at the scale and not seeing what they hoped right away. Who are questioning whether this was the right decision. And I want to say to you, look at these numbers. The scale is just one data point. These labs are the full story. And the full story that is something real is happening inside your body, even when you can't see it. Tell me below which of these 5 results surprised you most. And if you've had your own labs back recently, what did you find? I want to celebrate your wins too. Drop them in the comments. I read every single one of them and try to respond as soon as possible. If this video helped you understand your own labs a little bit better, please share it with someone on their own GLP-1 journey who deserves this information. And if you want to sit down with me and go through your own specific panel together, the GLP-1 Clarity Consult is open. There will be a link in the description to reach out to me if you want to sit down and have a Clarity Consult. Thank you for watching. Take care of yourselves, and I'll see you in the next one.